Hi everyone, my name is Andrew McCarty. I am a registered nurse and the stroke program coordinator at Mary Lanning Healthcare in Hastings, Nebraska. I've been in my position for the past 6 years, and I just wanted to take a few minutes to explain what our Innovator grant proposal was for this year's Mission Lifeline Stroke Summit. So back in 2016, our stroke team here at Mary Lanning created a multidisciplinary outpatient stroke clinic for patients being discharged from our facility with a diagnosis of stroke or TIA. And this outpatient clinic began with just a 2 week follow up for patients who were recently hospitalized. That model transitioned into seeing patients not only at 2 weeks following their hospitalization, but also 3 months out, and involving our rehab therapists from physical therapy, occupational therapy, and speech therapy. And these follow up appointments really allow us to reinforce the outpatient plan of care with the patient and family. It gives us the opportunity to, review medications with them, re-educate them on their diagnosis and individual risk factors, and ask questions about rehab or other follow-up appointments. And at the 90-day appointment, it also allows our therapist to capture an accurate 90-day modified Rankin score and really just assess the patient's progress and current level of disability. So our proposal involved expanding this clinic model to surrounding communities in our area, communities that have critical access hospitals. These are facilities we already coordinate with in terms of acute stroke care. And so we thought that this grant would be a great opportunity to also collaborate with them on outpatient stroke care. So the grant funds would have been used to purchase some basic telemedicine equipment, iPads and carts for these facilities, and really put together a plan to facilitate outpatient follow-ups for patients that live in these communities. The telemedicine approach would allow patients to stay in their own communities. For those patients that have transportation issues or deficits that really limit their travel. And we just think that the model we are currently using at Mary Lanning could be expanded to other primary stroke centers across the state, utilizing a similar model and partnering with their individual critical access hospitals for outpatient stroke care and management. So I just want to thank everyone for the opportunity to explain our proposal and congratulate those people or individuals who were awarded the Innovator grant funds this year. Congratulations.